Care of an episiotomy or perineal tears. During delivery, you can have an episiotomy or you can have tear depending on different degrees. But again, the doctors will decide to repair them to prevent further complications. Healing or recovery with an episiotomy during postpartum can be something very challenging. An episiotomy pain or perineal tear pain will exert pain while you are walking, the bowel movement, sitting. It can be a bit uncomfortable and painful recovery process if you are compared to someone who delivered without an episiotomy. Welcome to the Nursing Nurse. It's me, Nurse Janet, and in this video here, I'm going to share some tips that will help you in the recovery process with an episiotomy or perineal tears. Watch to the end. Just like any other wound healing, episiotomy too depends on your own immunity. There is no specific time that this wound will be healed, but again, between 4 to 6 weeks, an episiotomy should be completely healed. Some get healed within the first week, second week, so it all varies depending on different factors, again, in your body. Let's move to wound care. Remember, this is a place that was stitched, and these stitches doesn't have to be removed. Actually, they'll be absorbed by the body. And again, at this time, you're still getting your normal lock here. The blood's still there, yeah. So it's important to use pads and not tampons. Anything apart from pad, maybe cotton, but the most advisable thing here is to use is pad, sanitary towels. You'll realize you'll be seeing some stitches on the pads or on the panties. It is normal. How are you going to take care of this wound? If at all you experience it so painful down there, you can wrap an ice pack in a clean clothing and put it there. It will ease that pain. Another thing here is to do warm sitz bath. Actually, get a warm water in a basin. Not hot water, please don't burn down there and cause more problems. Just a warm water.
Add a glass
Add a
of
pinch
salt
of
in
salt
it.
in it. Then you have to sit there for about 15 to 20 minutes. Do this at least 3 times a day throughout your wound healing process until you feel your wound is okay. This will kill the germs, and again it will ease the recovery process. Keep the area dry by patting it with a soft dry towel. Yeah, you don't have to use tissue papers again here. Just use a dry towel to wipe, pat it and let it dry. Again, you have to change your sanitary towels frequently, at least 3 hours, because if you remain wet for long, there is a high chances of getting infected again, that there is blood. So you keep on changing your sanitary towels. At least 3 hours apart is not that bad. Again, another task ahead of you is going to the toilet with perineal stitches. It's not something you'd want to actually. So the best thing here is to try and avoid straining. You don't have to strain while going to the toilet. Yeah. So change on your diet. You have to drink a lot of fluids, get high fiber diets, and eat your normal diet alongside it. Yeah, just try as much as you can to avoid constipation. Because if you constipate, you'll be straining, and straining will delay your perineal tears healing. Take your antibiotics and painkillers to prevent any possible infection that might occur during the postpartum period. An infection can also delay the healing of the perineal stitches. And again, if you don't take your antibiotics, the perineal stitches too can get infected. Take shower as usual. Actually, you have to keep that place clean. Take shower or bath as usual. After that, dry yourself with a towel. Again, you have to try and do light exercise like walking. And again, for the perineal tears, try and avoid strenuous activities like bicycle riding, any activity that can lead to gaping of that area. If you feel your body is fully recovered, you can engage into sexual intercourse. Yeah, don't engage into sexual intercourse before that place is healed. It will gape.